Welcome to this series of short videos on children, digital lives and mental health. This is the first video of the series, and I'm Dr. Krisha Patel. The main aims of this session are for healthcare professionals who work with children to have a basic understanding of how children engage with technology and how modern day phenomena such as sexting, cyberbullying, online gaming and exposure to age-inappropriate or harmful internet content may be affecting children's emotional health and well-being. I wanted to recommend this extremely useful e-learning course to you. It's completely free to access, and I'll add the link to the description box below the YouTube video. Why is it important to understand how children engage with the internet? I'd like you to pause the video now and just write down your thoughts here. So the explosion of technology and the internet in the last decade has changed everybody's lives. I myself did not own a smartphone until I was in my mid-20s. Therefore, my experience of school and education and growing up is very different to that of children growing up today. Words like sexting and the ease of access to pornography and self-harm online content was not something I had to worry about when I was growing up. Children experience very different pressures today. And to put it simply, if we as healthcare practitioners are working with children, then we need to understand the particular pressures and difficulties they face if we want to actually support them. When it comes to children and adolescents, much or most of their social life is conducted online. There's intense pressure to have an online identity once a child reaches a certain age. There is expectation to be on all these apps and websites like Facebook and Instagram and Twitter. In fact, not being on these social media websites and not having a decent enough smartphone can be the reason why a child is bullied and why they are made to feel different. And if you think back to when you were a teenager at school, nobody wants to be different. We all just wanted to fit in. So there's a lot of pressure and expectation to be using various social media websites and apps and have that online identity, and school popularity can very much be based on things like social media likes and what somebody shows on Instagram of their life and social media usage. And the online world is so integral to the child's life that it's not appropriate to separate their online and their offline life. We have to think about it together. So I've taken this directly from the Royal College of Psychiatrists' latest report on self-harm and suicide that was published in 2020. And it says that we must start considering someone's online use when we're thinking about self-harm assessments. So the online world, especially social media, has a significant effect on the person at increased risk of suicide. All mental health professionals should recognize this, consider engagement with their patient's digital life, and include it within their assessment, especially where self-harm is identified as a possible factor. Some will find this easier than others. So this is a statement that applies to any age group, but of course this webinar series is about children. We need to consider the particular risks that the internet and technology can pose to children. And they are a particularly vulnerable group when it comes to certain things. We'll learn a little bit more about that in the next sessions. But the last statement says, some will find it easier than others. And I think that's particularly interesting because ultimately, it doesn't matter how much experience you have as a healthcare professional. This is a relatively new and evolving issue. So it's something we need to educate ourselves about as healthcare practitioners. So if we're thinking about possible risks of digital and online technology and the risks that they pose to children, this is just some of the things we need to think about. So children oversharing their personal information, exposure to age-inappropriate or harmful and extreme content, so age-inappropriate pornography or violent material, or harmful content from pro-self-harm and pro-anorexia websites. excessive use or addiction to gaming and social media, cyberbullying. Bullying is something that used to take place in schools. These days, cyberbullying is something that can happen 24/7. And extortion, sexting and sextortion, exposure to harmful content. I've already mentioned pro-anorexia and pro-self-harm websites, and sexual grooming. So there are many emotional difficulties. And by emotional difficulties, I'm not specifically talking about diagnosable mental health conditions. I'm just using the term in its broad sense of emotional and psychological well-being. So there are many emotional difficulties that are associated with online behaviours, such as from the fallout of a sexting picture, or from cyberbullying, or from the access to age-inappropriate content and grooming. And these include things like depression and anxiety, stress from exposure to extreme content and exploitation, low and negative self-esteem, issues with self-harm and suicide. And I've added a headline from the Daily Mail, I think, which says teenager commits suicide after sexting a nude photo to her boyfriend made her life a misery. So let's not underestimate how something like sexting and cyberbullying can really affect a child's life and cause suicidal thoughts, and in the worst situation can actually lead to somebody ending their life by suicide. There's also body image disorders, such as genital size anxiety and performance anxiety from watching pornographic content and feeling inadequate because you don't fit up to that pornographic image. Difficulties with emotional and sexual well-being. And though we can't say the internet is the root cause of these mental health issues per se, it's clear that some online behaviours do pose a risk and contribute to these emotional difficulties. There may be some children who are particularly vulnerable to this sort of online risk, such as sexting, and that could be due to their own well-being issues around anxiety and low self-esteem. So it can be a vicious cycle in a way, where those who are perhaps more prone to mental health problems and those who may be more depressed and more likely to self-harm may be the ones who are more likely to be using the internet inappropriately and engaging in risky online behaviours. So that takes us to the end of this session, and in the next session we're going to focus on how sexting can affect children's mental health and define what these terms like sexting and sextortion actually mean.